series of trending topic discussions on COVID-19. Last week, we had Dr. Dalui, who talked about the current trends in COVID-19 infection in India. To follow it up, for the second part for today's session, we have Dr. Pritam Roy, public health expert, state COVID trainer, a physician, and a trained epidemiologist. Dr. Pritam Roy has wide range of experience in patient management, epidemiology, biostatistics, along with various areas of health and public policy, including maternal and child health, neglected tropical diseases, vector-borne diseases, developing and implementing health interventions, and health system strengthening. Today, he shall be talking to us about the landscape of COVID-19 vaccination in India in connection to the third wave. So, without further ado, let's get started. Welcome to DocPlexus, Dr. Rao.
Yeah, thank you. So today we will be discussing about the strategy of COVID-19 vaccination in India. Then we will having a discussion on the vaccine landscape. The vaccine for the children, which is upcoming in India. We will also discuss the third wave, the transmission possibilities and the mechanism. Besides, we will be discussing about the emergence of variants and its implication in India. And lastly, we will talk about the way forward that we all are looking about. So to start with, the strategy for COVID-19 vaccination in India, we have a free vaccination campaign in India, COVID-19, which started on January 16th, 2021. And the government is urging all its citizens to be immunized. And what is expected is that it will be the largest vaccination program in the world. So out of the 8 COVID-19 vaccines that are currently under various stages of clinical trials in India, 4 were developed in our country. So Indian's drug regulator has already approved the restricted emergency use of Covishield, the Sputnik, the Covaxin, which is a homegrown vaccine produced by Bharat Biotech. So India manufacturers have started that they have stated that they have the capacity to meet the country's future need for vaccine campaign. So COVID-19 vaccine candidates are under production and in collaboration with various pharmaceuticals companies, biotech companies, and they have signed collaborative agreements with also few of the foreign-based vaccine developers. So we have a range from conducting clinical trials to large-scale manufacturing of vaccines and their distributions. And these clinical trials in India are among the leading products internationally that we have these candidature vaccines. So let's see what are the different types of vaccine that we are currently having. We have the Covishield, which is a non-replicating chimpanzee adenovirus vaccine vector. And we have the Covaxin, which is an inactivated virus vaccine. We have the Zydus Cadila COVID, which is a plasmid DNA vaccine. And we also have a few other from companies which are unnamed and has been given a name, which will be most probably a recombinant RBD protein-based vaccine with an adjuvant. And then we have the Sputnik, which is an inactivated human adenovirus 85 and 8026 with spike protein inserts. And we are also coming up from Pune, one of the mRNA vaccines. So these are the major vaccine landscapes that are available currently in India in different trials, and we will be having them. A few of them are already available in the market, and few will be coming in certain phases. So what's the strategy for the government? So the main strategy, the government is the vaccination program is built on a very scientific and epidemiological evidence, and along with the WHO guidelines and global best practices. So it is anchored in the systematic end-to-end planning, which is very important, and it's implemented through effective and efficient participation of states and union territories and the people at the large. So if we look at the vaccination program, so we have prioritized few groups. So the healthcare workers, the frontline workers, the citizen more than 45 years of age, those who have the second dose due. There are super spreaders who needs to be in this vaccination strategy, and the citizens of 18 years and above. So practically now, citizens about 18 year and above are all prioritized, and that depends upon the state specific, unions, territory specific, their own prioritization, factoring the vaccine supply schedule and the group they want to cover. So that's how the states are working, the health departments are working to get the vaccination done and cover the people at large. So regarding the children, so this is a very upcoming topic of discussion. The children's, the third wave, the pediatric age group may be affected. So let's first, from the vaccination point of view, let's look which is the COVID-19 vaccines for children in India. So currently we have the three companies. So the Bharat Biotech vaccine, the Covaxin, which is mainly the trial is going on the phase 2 and phase 3 trials, mainly targeted to 2 years to 18 years children. So the recruitment is in progress and the results are yet to be published. The vaccine may come in the market. So currently what we have is the Zydus Cadila vaccine. So it has three strata specific trials. So one, 2 to 6 years, another 6 to 12 years, and then we have 12 to 18 years. So the results of 2 to 6 years and 6 to 12 years are yet to be published. So that's an ongoing, but 12 to 18 years has already been published and we'll be discussing. Besides that, we have also trial for children of Covovax, and we are awaiting the safety data for the adults and approval from the DCGI. So that's what the landscape when we are talking about the COVID-19 vaccine for children in India. The Zydus Cadila Covaxin that has recently got the authorization from Drug Controller Government of India will be the first world's first DNA vaccine, which is very important, and I think that is very very good news that we have something for the children. So it's become the fifth vaccine cleared for use in the country after the locally procured Covishield, Covaxin, Sputnik, and the US made Moderna. So it's the first DNA vaccine to get the nod in any country. I think this is very, very crucial. And then this vaccine will be given in 3 doses with an interval of 28 days in between. So the first, the second, and the third dose, and we have intermediate of 4 weeks gap in between. And also one of the particular thing that is very important that no needle is used while administering this vaccine to the beneficiaries. So what they will do instead, spring power device delivers the shot as a narrow, precise stream of fluid that penetrates the skin. So that's very important. I will just try to show the audience like this will be one of the things that will come, and how we prepare the injector, how we'll fill the syringe, and how we will load the injector. And the injection will be given without any needle, which reduces the adverse event due to needle prick or like any apprehension because of needle prick. All can be reduced, and it is very safe and very easy to administer. So that's another important development in the vaccine phase, especially for the children, for the Zydus COVID vaccine that we have currently in India. So now let's talk about the third wave. So the threat of COVID-19 third wave. Everyone is talking about whether it is a second wave that which is ongoing, or a third wave, when it will come, what will be the magnitude, and how it affects. So whether, like if we talk about that, so one of the most important thing that we are all discussing now is the third wave. So whether India will be facing a third wave, when will it come, what will be the magnitude, what will happen. So a lot of discussion is ongoing. So in this context of India's ongoing resurgence of COVID-19, so the second wave we have witnessed in mid-February 2021, following the subsiding of the first wave, which was in September 2020. And there has been an increasing speculation on the possibility of a future third wave of infection. So, and that may pose a burden on the healthcare systems. So, what we found recently that different institutions, the academia, are using the mathematical models of transmission dynamics of SARS-CoV-2, which may occur. So they are looking at the models and trying to estimate and do a trend that when things can go in a different way. So what we need to understand that if there is a third wave, what can be the potential mechanism for the third wave to occur? So we looked upon the four potential mechanisms. So one is the waning immunity, which restores previously exposed to individuals to a susceptible state. So that's one. Then emergence of a new viral variant, which is capable of escaping the immunity to previous circulating strains. Third can be the emergence of a new viral variant, which is more transmissible than the previous circulating strains. And lastly, the release of the current lockdown affording fresh opportunities of transmission. So these are the four possible mechanisms how a third wave can occur in India. Now let's go one by one that what will be the effect. So if we look at the first 2 points, so the immune mediated mechanism, the waning immunity, or maybe the viral evolution for the immune escapes are unlikely to drive a severe third wave if acting on their own. So based on only this factor, there is a less chance that a severe third wave will occur, and is only possible when there is a complete loss of protection of the immunity among those previously exposed. So the chance is very less. Likewise, uh, the possible of a more transmissible variant, it needs to have the high threshold, and it should exceed the not more than 4.5 to cause a third wave of its own. So currently, uh, based on these two things, it is very, very unlikely that a severe third wave may occur because these two scenarios are less likely to occur. Now, what are the others? So the other two plausible mechanisms that remained is that the development of a new variant that is more transmissible and at the same time are capable of escaping prior immunity, and the lockdown that are highly effective in limiting the transmission if released subsequently. So there are lockdowns are taking place in different forms and ways in different parts of India, and a sudden release of the lockdowns may upsurge the cases. So these can be the two plausible mechanisms. But whatever that may be, in both the cases, any third wave seems to be unlikely to be as severe as the second wave. Even if we consider these two, this is very unlikely. But what we need to do is that we need to have a rapid scale up of vaccination efforts. And I think that could play an important role in mitigating these and future waves of diseases. So the most important step that we need to have is the adoption of COVID appropriate behavior, which is very, very important. And secondly, the rapid scale up of vaccination efforts. So that will help in mitigating the factors. The if we look that what are the implications, the emergence of these variants and its implication in India. So what we found that in India and even in other countries currently dealing with the Delta plus variant of the coronavirus and a possible advent of a third wave, which we have from a recent paper from IIT Kanpur. They projected that the wave will be only a ripple effect if there is no significantly rapidly spreading mutant. So this understanding of a spreading mutant is very important. So if we look at the emergence of variants and its implication in India, So what we see that WHO, in collaboration with the different partners and expert networks, are already trying through the national authorities, are already trying to look on assessing the evolutions of the SARS-CoV-2 vaccine since January 2020. So during late 2020, so what we are trying to find out, the emergence of variants that posed increased risks to the global public health, and which prompted the characterization of the specific variants of interest, which is very important, and also the variant of concern. Uh, and in order to prioritize the global monitoring and research and ultimately to inform the ongoing response to this COVID-19 pandemic. So now let's look one by one. So if we look at the variants of concern, so first, it increases in transmissibility or it causes a detrimental change in COVID-19 epidemiology. Secondly, it increase in the virulence or change in the clinical disease presentation. And thirdly, it decreases in the effectiveness of the public health and social measures or the available diagnostics, vaccines, or therapeutics. So that's why we have a lot of variants of concern like alpha, beta, gamma, and delta, which have been documented from UK, South Africa, Brazil. So these are very, very important to understand that how these lineages are ongoing. And then we have the variants of interests. So those are mainly causing the significant community level transmission or multiple COVID-19 clusters. In different countries, like the increasing the relative prevalence along with the number of cases over time has been because of this variant of interest. And the apparent epidemiological impacts risk the global public health issues, especially because of these variants of interest. And if we see, we have the different lineages like the eta, iota, kappa, and lambda. So the kappa is also very important in India, which had caused significant community level clusters in different parts, which on later on was taken away by the delta variants. So besides that, we have the currently designated alerts also. So these alerts are very important for the further monitoring. So what we do is that we keep on monitoring the different lineages which are coming in multiple countries, and we are trying to look after whether these alerts are actually a variants of concern or variant of interest or not. So ongoing monitoring of this alert is very, very important. So now, what is its implication in India? So the global data continues to expand, and if we see that the delta variants uh, is very important in China and Korea, where we are seeing new heights of cases. And in fact, in Korea has reported that the new surge with the Delta plus, so K417 and mutation, and also the variant of concern of Delta, which continues to evolve. And even a number of lineages of Delta variants has been observed in the spike protein as well as in other proteins have come up, and that has come up from the different parts of the world. So we have those 13 sublineages of delta which has the characteristic genetic mutations, and of these I think uh, which is very important is the AY1, AY.2, and AY.3. I think they are the predominant lineages that are globally and also in India. And this AY3 is also been found recently in US and other countries, and AY12 has been from the Delta has been from Israel. So all these sublineages are being closely monitored from across the world and also in India, because they are very, very important to understand that how the transmission dynamics may change. So coming to scenario in India, what we are seeing that these are being seen from the July samples onward from Maharashtra at frequency of about 1%. So we are continuing monitoring these new sublineages. And the other sublineages, what we have found, doesn't have a growth advantage over the delta, which is currently the parent lineage in India. So there has been a concern about whether the increasing vaccination breakthroughs in India are because of this new variant or not. So I think currently the data is limited to what we cannot definitely comment on it. But what we have observed in UK with a population of about 6.7 crore, about 18 lakh cases and 1.2 lakh vaccination breakthroughs with Delta since April 2021. So we need to have an understanding of the breakthrough cases of vaccination. But saying so, what is more important? So the most important, if we go from a summary point of view, is that the new variants are ongoing, but currently in India, the major variant of concern is the Delta variant. So these may cause some local continuing outbreaks. So maybe some in some part of the districts or in some in one district or part of districts, there may be some local upsurge of cases because of this susceptible population or reduced effectiveness in blocking the transmission. But saying so, vaccination continues to be the very effective in reducing severe disease and health and the death of the people. So to reduce the severe diseases and death, the most important public health measure still remains vaccination. And vaccination remains the most critical component which can actually prevent the upsurge of the third wave or the magnitude or the burden of the third wave. So that's very, very important. So if we see the distribution of cases, what we see that the Delta variant is majorly there. But if you see that even there still we have a 0.2 percentage of Delta plus in the monitoring. When India is monitoring the variants, there is still a little but Delta plus is there, which is very, very important. And India is ongoing with the monitoring of those data. So that's really helpful. So coming to the end of our discussion, if we wrap up our discussion in the way forward, we will be discussing about the three most important things. First, what is important now for us? Most important is we had seen the first wave, the second wave. So we have a huge number of cases already existing in the community who have suffered from the COVID vaccine, from the COVID cases. So the post-COVID follow-up will be very, very important. So that's very important, the follow-up of COVID patients. Second, the vaccination. We need to expand the vaccination. And we also need to understand what the newer initiative ongoing in the vaccination. So if we look at the post-COVID follow-up, the COVID-19 symptoms, even maybe people are young or otherwise healthy people, even they can feel unwell for weeks to months after infection. So that's very, very important for us to understand. And if anyone is suffering from any of these problems, they must get their health checkup. So like fatigue, like worsened symptoms after any physical activities, even mental fatigueness, there may be shortness of breath or difficulty breathing or cough or a fast heartbeat. There may be chest pain, there may be joint pain, muscle pain, body pain, headache. A lot of people are suffering from a lack of concentration or sleep disorders. And some of the people are continuing that the loss of smell or taste is not recovering. And a lot of people are also facing the depression or the anxiety. Some are also facing like the dizziness or lightheadedness when they stand up from sitting or lying position. And we are also getting cases of thromboembolisms and severe reports. And besides like the chronic kidney diseases. So these are very, very important. So the post-COVID follow-up is one of the upcoming important thing. So that will ultimately help us a healthy public health policy. So these different institutes are maintaining a protocol, and we think we need more post-COVID follow-up clinics, maintenance of their health, diagnostics, and giving them, including the psychosocial counseling, which will be very, very important. Second, the vaccination. India is doing good in vaccination. We are doing a lot of vaccination, but we need to cover it first. So that's very important. So as on today's date, I think 9.3% has received both the doses, and uh, so that's, we need to improve upon that. So though 32% has been, almost one third is almost under cover. uh, so the more we go about this vaccination, if we can cover more than 65% in a short while, I think we will be able to cover any future third wave. So that is very, very important. Lastly, I will discuss about the few studies that are ongoing, which is really, really interesting. So one of them is the mixing of COVID-19 vaccines. So some people are talking about that. So the mix and match, or the heterologous priming, or the boosting approach. So a lot of people are asking about that. So let's see it is. So a few studies have shown that they have a higher level of antibodies. Uh, so that's one point. Second, some are talking about that these mix and match studies can actually accelerate the vaccination drive, and the person may not have to wait for the same vaccine, and can take other available vaccines. So that's one of the pros they are talking about. Thirdly, the people are telling that those who need to be traveled in other settings, so after the first dose, they can complete the schedule earlier. And fourth, a lot of people are talking about that there might be a need for a booster shot in the longer run. So it is important to understand whether a booster shot of a different vaccine can be given or not. So these can inform us that which booster shoot and in what combination generates higher antibodies. So basically, these are all in the research mode that is ongoing. So there has been an ICMR study. They had taken 18 participant and 80 comparison group. So now they are doing another study for this with the 300 sample size. So then there are other studies which took place. If we look at the international evidences, in Spain, the Combivac, they had the 663 participants. In UK, they had Comcov, which had 830 subjects they had taken. And so in India, we are doing with the 300 sample size of this study. So, but what we need to remember that none of these studies estimates the efficacy of the mix and match. So that's not our aim is. But we are actually looking that the efficacy is estimated through the phase 3 trials, which need a few thousands of individuals. So what we are looking is they are focusing mainly on the assessing the safety and the immunogenicity. So the measuring of the antibodies. And these would provide us an useful understanding that how we should go, whether it is possible or it is not possible. So if we look at we need to also look at the real world data. So of the real world data, we currently in Bhutan, they have done these things, different vaccine or second shot, because of the first shot was not available at that country. And also the number of countries are also using the vaccination drive. So we should all look at their evidence, whether this evidence is acting in a correct way or not, and how helpful it is for us. But most importantly, currently in India, mixing of COVID-19 vaccine is not practiced or neither recommended. So it's all in trial, or in we are looking after from different studies. But currently we don't recommend mixing of COVID-19 vaccine, and it is neither practiced nor recommended. So coming to the end of the session, the most important questions that everybody ask: when will this pandemic end, and when we can go back to normal? So very frankly speaking, we don't know when this pandemic will end, but from different areas, from different concerned authorities, from the reports, we are getting a hint that this may go to an end in coming days. So even if a third wave after that, the things will become definitely normal. But it all depends upon every person's contribution in helping to stop the spread of virus. So we have put societies and the economies on hold. So we have reduced the ability of the virus to spread through our communities. So that the defensive measures that have helped to limit the damage the virus can cause, and brought us the time to learn more about the virus and to find new solutions. So that is why in certain parts of the world it has been possible to reopen the businesses or maybe schools in different parts. So it is very important for us to continue the practice, the recommended measures, and also encourage our known tools, nears and dear ones to adopt that thing. Only knowing will not help. We need to adopt the COVID appropriate behaviors, and so then the situation will not get worse, and definitely we will be able to have a pandemic free status in upcoming days. As we strongly believe that with our concern, with everybody's effort and practicing the COVID appropriate behaviors for in upcoming times, we will be definitely able to curb the third wave or the burden of the third wave, and definitely we will have a time when we come upon this virus, and things will become normal. So we are hoping to get back to normalcy in coming days. So with this, I end my session. Thank you, everybody.
Thank you, Dr. Pritam. I think a very good presentation here. We have some questions for you. So, moving on, we'll take these questions first. So, one question is from Dr. Satya Murthy. How to tackle the third wave of COVID-19 if it arises in India?
So that's what I was already pressing about, that we need to continue with the COVID appropriate behaviors. That is very, very important. And second, increase the vaccination coverage. So that will help us to fight the COVID third wave effectively. That all we can do, apart from the government and other institutions are doing their preparedness. So the institutional authorities are doing their activities, but we as people need to be more cautious this time.
So, another question for you is, so what do you think about the single dose vaccination? Will it be effective? And also, your opinion on the third dose, booster dose for vulnerable individuals?
So we have come upon these different opinions. So what I have already discussed in my presentation also, that evidences are coming up. So it's an evolving process. So day by day, we are getting new evidences, we are getting new knowledge, and so that we can use in the future. So currently, at this point of time, it's very difficult to say whether it will be helpful or not. But definitely, we are looking at the evidences in different parts: the single dose, the booster dose, the combination. And I think in upcoming days, we will get some concrete evidence to act upon.
So, I remember you did talk about the different kinds of vaccines that are available in India. So, do you think our vaccines are against the emerging variants? Are they effective enough?
Yeah, though we are getting the breakthrough cases of vaccination, but I still believe, and the data also speaks about that, vaccination is helpful. So maybe a part of cases we are getting is a breakthrough vaccine, but those cases are not so much severe and neither causing a serious death. So if we look at the vaccine effectiveness, so that's very important. The vaccine is actually giving protection. So those are not vaccinated and those among the vaccinated, the difference is clear cut. So currently, if we really want to curb the third wave and end to this situation, vaccination is must, and we must rely on our vaccination, whatever may be the brand, whatever may be the composition, but vaccination definitely have its own role there. It may not be 100%, nothing is 100%, but definitely there is a good role.
Sure, sir. Another question is about the government policies. So, what kind of policy should be formulated to reduce the viral transmission rate of the COVID-19 variants?
So even the government of India and the different state government has come upon with their own task force, their bodies which are making the plans. So we have learned from our previous experiences where things went wrong or where we need improvement. And I think the government is doing a fantastic job in creating an expansion of infrastructure, getting all the things done. So currently, we are in a better position because we got this time. We are getting prepared, and also we have got time to expand the vaccination campaign more expand, and also the development of infrastructure, coming up with guidelines, policies. So that will be very much helpful. And I think with the different international bodies with their guidelines, the national guidelines, local colleges, public health experts are coming up with their opinions. So we are in a good way to handle the situation right now, far better than what we are at the beginning. So we are now better prepared.
Correct. So, one last question from Dr. V. Chandrasekhar. Is Delta plus variant causing the third wave in India? And if so, how long does it take to form the peaks?
That's what I saw. I showed in my presentation that the Delta is a major variant of concern now, but Delta plus of 0.2% has been observed in India. But it will cause a third wave. We cannot say it right now, but because these variants work in a very different way, nobody can predict actually. But the more important is whatever may be the variant, if we adopt the COVID appropriate behavior and went in through these steps, I think in near future we can prevent whatever we may. But the thing is that we are observing that while local transmission are occurring and whether it is because of which variants. So maybe October or November we can have a peak of a third wave, even if it actually takes place. Hopefully it doesn't take place, that what we expect, but because of a particular variant, it's less likely of Delta plus. But the government, the regulatory authorities are having a close monitoring of the variants of concerns or variants of interest what are coming, and they're also looking at the future alerts. So that will be a way to measure how things are going different, and so that we can take step locally at that point of time.
Sure, sir. I think these were all the questions that I had. I would like to thank you again on behalf of DocPlexus. So, very grateful for your valuable insight on the landscape of vaccination strategy and management. For also our great viewing doctors, thank you so much for your loyal viewership and support to DocPlexus. We will be back
Thank
with
you.
such enriching sessions. Until then, please take care and happy DocPlexing. Thank you so much, sir.